We all know that we're facing a major health crisis with COVID-19, a global pandemic. This is a challenging time for all British Columbians. And I want to relay our government's gratitude to the large majority of people who are following the guidelines of the Public Health Officer and helping our province to flatten the curve. But since the pandemic began in British Columbia 5 weeks ago, there have been suspected overdose deaths in Victoria and many more here in Vancouver. Just this week, 2 more people died in Victoria's Topaz Park. This is unacceptable. Far too many people are being lost to addictions. And while the fear of COVID-19 sweeps through our communities, we must also remember there are those who are facing this pandemic without shelter and without the support which many of us take for granted. These are people with no place to isolate, no rest or relief from this growing global threat. We have heard from the cities of Vancouver and Victoria. We've heard from neighborhood residents and associations, religious leaders, support workers, counselors, advocates, friends, and families that the situation is unacceptable, and we're listening. We are at the confluence of 2 of the most challenging health emergencies our province has ever faced, and we cannot leave our most vulnerable behind. The time to act is now. That is why today I am enacting an order in coordination and collaboration with local governments and service delivery partners. It's taking place under the Emergency Program Act and as part of the current provincial state of emergency. The province of British Columbia has developed, in consultation with the cities of Vancouver, Victoria, associated police, fire, and other agencies, non-government organizations, and stakeholders, a comprehensive plan to make sure that those in the tent encampments in Vancouver's Oppenheimer Park, Victoria's Topaz Park, and along the Pandora corridor are provided safer accommodation to isolate during this pandemic, and the opportunity, with our support, to lift themselves out of poverty and to break the cycle of addiction. To be clear, this is a public safety order, not a health order, as this situation has a lot of complicating factors beyond just being a health emergency. And as an order under the Emergency Program Act, police and other compliance officials are able to enforce any violations of this act. We know there will be big challenges ahead, and we know that this needs to be done carefully, the right way, with wraparound health and social supports.
We know that we need to do everything that we can to protect and support our most vulnerable people, including those experiencing poverty and chronic homelessness. As a first measure, the province did provide financial supports through enhanced income and disability assistance for people, $300 of additional crisis supplement on the April, May, and June checks, as well as support through the federal CERB program. This measure has provided some level of financial support. We need to do more. Premier Horgan brought together members of the Cabinet to put together an all-of-government plan that builds on the foundational work of Minister Selina Robinson and BC Housing that has put in place the initiatives that we are going to build on and that we will announce today. We have been funding and building thousands of units of housing province-wide, housing that is designed to bring people off the street and to provide them with secure accommodation. We have been supporting people on the street over the last 3 years since this government came into place. We know that we need to do more, and we know the COVID-19 crisis has accelerated this already urgent situation. So today, under the order that Minister Farnworth has issued, I'm announcing that we are preparing to dismantle encampments in Oppenheimer Park in Vancouver and along Victoria's Pandora Avenue and Topaz Park, and to bring the residents of these camps inside, primarily into hotel rooms and also into other accommodation supports that will be made available. These encampments present an elevated risk of an outbreak of COVID-19 in these communities. It's becoming increasingly difficult, if not impossible, to follow the provincial health officer's directions on physical distancing, on important hygiene practices, and quarantining for those who may be feeling any symptoms of sickness. Adding to our concerns, healthcare workers have withdrawn services from the encampments for safety reasons. We are taking necessary steps to support people's transition from unsafe, dense encampments into temporary, safer accommodations with space to self-isolate, access to hygiene facilities, and important wraparound healthcare and social services. This work will be done in partnership with the City of Victoria and the City of Vancouver. Since the beginning of this crisis and before, BC Housing has been working around the clock to secure over 1,700 new spaces to house people in communities throughout the province. This includes 324 spaces in Victoria and 686 spaces in Vancouver. People will continue to receive daily meals and medical care when needed. Facilities will also be equipped with cleaning services so that they remain safe and hygienic. We're looking at how to accommodate the safe transfer of people's belongings, to provide safe supply, and honor the preferences and needs for friends and family to be housed together or close by. Many of these spaces will be in emergency response centers and hotels and will serve as interim housing and shelter solutions to prevent the spread of COVID-19. We will use these sites until we can provide more permanent housing options to keep people supported far beyond the time of the pandemic. I want to take a moment to speak directly to the people in Oppenheimer Park, Topaz Park, and on Pandora Avenue. I want to acknowledge that this will be welcome news for many people in the encampments, but it will also cause anxiety and hesitation for others. Our priority is your health and safety. We are doing everything that we can do to make sure you land in a safe, sustainable, comfortable place with the support services you need. I know that this may seem uncertain, and I know that while there are lots of dangers in encampments, there is also a sense of community. This transition will not happen overnight. It will be done with care and compassion, and it will be done over a period of transition. You will not be alone, and you will not be abandoned. Now is the time we must continue moving forward with bold measures to house our most vulnerable people and to do so in a way that creates long-term healthy solutions. The order today is the first step to make that happen. In the following days and weeks, we will be providing updates on next steps and details how wraparound healthcare and support services will work. We are working with our community partners to make a difference throughout the entire community. For example, we are investing in cleaning and thousands of meals each day to support those living in private SROs in the downtown east side. We are supporting the work of peers and thinning out shelters to ensure better physical distancing that is about bringing healthy living to these communities. It is a very large undertaking, but together with the support of our partners, we can keep our most vulnerable people safe and secure during this time of crisis and beyond.
We have lost a staggering number of our friends and neighbors and loved ones in this crisis, over 5,000 since 2016. And so many families and communities have suffered unimaginable grief. And while the number of deaths began to go down last year, we continue to lose 2 to 3 people every day, and we are at risk of losing more. And now the overdose crisis has been compounded by the global coronavirus pandemic that has changed everyone's lives in this province. We know that everyone needs to do their part to slow the spread. Everyone needs to do their part to flatten the curve. But when you are homeless or precariously housed, or if you're dealing with an addiction or a serious mental health challenge, if you are struggling just to survive every day, trying to meet the physical distancing guidelines feels practically impossible. And while we know that mental health and addictions affects people from all walks of life, There is no question that people who are homeless and living in encampments often experience greater mental health and addiction challenges than people who are safely housed. They face more stigma and more judgment than almost any other group in our society. I know that many people who are homeless feel invisible, forgotten. We're here today to say, we see you, we hear you, and we're taking action to support you. Today's announcement is a profound commitment that we will do everything we possibly can to keep you safe in the face of 2 public health emergencies. But today's announcement is also about greater hope for the future. We have been working at breakneck speed across all levels of government and with our community partners, large and small, to be ready, so that people who are now in the encampments can rest their heads at night in a warm, dry, safe place. To be ready so that mental health and addiction supports will be there through this pandemic and beyond. That means social workers, doctors, nurses, nurse practitioners, outreach workers, mental health clinicians, peers, and others will be at each site to help people stay safe, feel supported, and get the care that they need. And these teams will also offer a vital connection during a time when knowing that someone is there for you is more important than it's ever been before. For people living with addictions, these teams can help people create a manageable treatment plan to stabilize their lives, to help to ease the symptoms of withdrawal, connect them to resources in the community, and very importantly, be there to listen and support them without judgment. And we will continue to escalate our overdose response, both to save lives from fentanyl poisoning and, very importantly, to connect people to treatment and to recovery. Last month, the province of BC announced new clinical guidelines to help people at risk of overdose, withdrawal, infection, and COVID-19 get safer prescription alternatives to the poison drug supply on the street. And this includes safer alternatives for people with addictions to alcohol, to nicotine, to opioids, tobacco, stimulants, and other substances. These guidelines outline how people can get their prescriptions more easily through virtual care, flexible delivery by pharmacies, longer carries of medications, and other measures. Because nobody should have to risk their life to get the medication that they need. We're also working to ensure that access to essential health care, like overdose prevention services, remain available and safe for people who need it throughout this pandemic. And we have significantly increased access to counseling for the most vulnerable groups in the province, as well as virtual counseling supports for all British Columbians at this difficult time. This is a critical part of our work to build a full continuum of mental health and addictions care for all British Columbians. I want to thank Minister Simpson and Farnworth, and also Minister Selina Robinson and Minister Melanie Mark, and the entire team that has worked so hard to make these opportunities available. Because everyone deserves a chance to find a pathway to healing and a pathway to hope. And having a roof over your head, having access to food, having access to health care and social supports are all essential to finding that pathway to hope. As we stare down 2 public health emergencies, we're saying we don't want anyone to be left behind, because the only way is together.